Hello, my name is Kristi McManus, and I'm a recent graduate of the Master of Nursing program at Athabasca University. Through my clinical experience in occupational health, I have seen the impacts of the healthcare system on the mental health and resilience of healthcare workers firsthand. These observations have translated into a passion to further examine the needs of healthcare workers in order to determine effective, sustainable strategies to mitigate these risks and safeguard the healthcare workforce. Therefore, today I will be presenting my research project, Leadership Strategies to Support Mental Health Resilience in Healthcare, a literature review. Through the provision of care and unique structure of the healthcare system, healthcare workers are at a higher risk for impaired mental health than the general public. Contributors such as excessive workloads, high-stress environments, and unsupportive organizations have been shown to result in impairments such as depression, stress, post-traumatic stress disorder, and more among healthcare workers. These experiences do not only affect staff, but patients through decreased continuity of care and patient safety, and organizational stability through 20% of nurses leaving their position within the first year, and more than 30% turnover rates. This demonstrates the systemic impact impaired mental health and resilience among healthcare workers has on healthcare and the need for effective strategies to mitigate these trends. This literature review was developed first through the research question, what strategies can be implemented by nursing and healthcare leadership to improve and maintain mental health resilience in healthcare workers? From there, the thesis statement was developed with a solution focus. Collaborative leadership strategies, such as shared governance, resource allocation, and effective programming, can result in increased satisfaction, decreased turnover, and improved coping, and are essential to address mental health resilience and wellness in healthcare workers in order to safeguard the healthcare workforce. The review utilized Whitmore and Knaf's stages to analyze literature from ProQuest, Ovid, Google Scholar, and more, focusing on keywords such as mental health, resilience, healthcare worker, leadership strategies, and more. Inclusion criteria included English language articles related to the subject, while exclusion criteria eliminated non-English language papers that did not focus on mental health, resilience, or leadership strategies. The review yielded 33 papers which were critically examined. These were then categorized by subject focus, geographical location, and research method, as you can see provided in Table 1. Further examination identified key impairments, contributing factors, and implications as identified in Table 2. Finally, strategies noted within the literature were examined for impact, such as seen in Table 3. Through this review, common themes with regard to strategies were identified, which included shared governance, resource allocation, and resilience programming. The first strategy of shared governance is the practice of involving staff in decision-making that directly impacts their work. This is shown to result in improvements in mental health and resilience, particularly through increased job satisfaction and improved patient care, with a decrease in turnover and adverse patient events. To implement this strategy, it is recommended that leadership involve staff early in the process, allowing them input at all stages of programming to be active partners in the initiatives meant to support them. The second strategy that was commonly highlighted in the literature was the importance of appropriate resource allocation. An important distinction in this strategy is that financial and human resources are needed to successfully implement programs. While there's an initial upfront cost to this strategy, the benefits cannot be ignored, with the noted 68.7% improvement in resilience and up to 30% reduction in absenteeism in the first 3 years. Mental Health Resilience Program has shown a $3.37 ROI on the dollar, which is significant. As mentioned, this strategy requires both financial and human resource allocation. Financial considerations include the cost of enrollment in external employee assistance programming and the cost involved in program development, whereas human resources include dedicated debriefing personnel to conduct regular debriefing sessions on all units, not only after critical events, and the recruitment of peer support volunteers on all units to provide direct peer-to-peer supports. The final strategy is resilience programming. This is employer-based programming that provides timely, on-site, or virtual supports for staff experiencing mental health strain. It's important to note that while impaired mental health among healthcare workers is a well-researched topic and one that's been discussed at all levels, only 12% of resilience programming is employer-based. This demonstrates a significant gap in the provision of staff wellness care within organizations that must be addressed. Such programming demonstrates a culture of support and can focus on preventative measures to mitigate impaired mental health. Recommended programming for consideration includes employee assistance programming, which are external partnerships providing employer-sponsored confidential support to staff. Debriefing, as previously mentioned, through a dedicated specialty-trained facilitator to provide regular opportunities for staff to engage in discussion in an open, supportive forum rather than only following a critical incident. Finally, peer support programs such as RISE allow for unit-based volunteers to provide timely, relevant support to colleagues from a position of familiarity and shared experience. In conclusion, challenges such as excessive workloads, high-stress environments, and unsupportive organizations can result in depression, stress, post-traumatic stress disorder, and more among healthcare workers. This in turn impacts not only staff, but patients and organizations through turnover, decreased quality of care, and an unstable healthcare workforce. Investing the same time, resources, and attention in supportive initiatives for healthcare workers as are provided to patients can mitigate the impacts of the healthcare system on healthcare workers, improve patient outcomes, and safeguard organizations. I wish to thank Athabasca University for allowing me the opportunity to develop my research skills during my time in the Master of Nursing program, and to the Graduate Student Research Conference team for allowing me to speak on this vital healthcare topic. I welcome any comments or questions and wish you all a wonderful time at the conference. Thank you.